Many women who come in who ask for and need a breast implant exchange also need a breast lift or mastopexy. What often happens is that over time, the soft tissues stretch out, both just due to natural aging as well as the weight of the underlying implant, and that soft tissue envelope needs to be tightened up. Along with this, oftentimes is the nipple is too low, and the nipple also needs to be elevated to the appropriate elevation or position on the chest at the same time that the skin is tightened up. So usually these women come in, they've had implants in for a while, and they have loose tissue hanging off the implant, which we call a Snoopy's nose deformity. And to correct it, what we have to do is a breast implant exchange. So we have to take out the old implants and put new implants in if they want to keep implants and have implants again. At the same time we do this, I need to perform a breast lift or mastopexy. Now, if the skin is very loose, and if the nipples are quite low, and if you have what's called a vertical excess, meaning you have too much skin in the vertical dimension of your breast, you will need a Weiss pattern mastopexy, which is the anchor-shaped scar. We call that a Weiss pattern mastopexy because that is the only mastopexy that allows us to tighten up the skin in all dimensions as well as move the nipple to wherever it needs to go. So that is the most aggressive and definitive mastopexy technique, is the anchor-shaped mastopexy or Weiss pattern mastopexy. And if you're having an implant exchange at the same time, I will access the pocket and remove the old implant and put in the new implant through the same incisions that I will use for the breast lift or mastopexy. Now, oftentimes other things need to be done. You may need a total capsulectomy if your implant is ruptured. You may also need a neo-subpectoral pocket or a new virgin pocket to control the position of the new implant. There's lots of other variables that can be corrected at the same time, but the scar is the same. It is an anchor-shaped scar on your breast, and the length of those incisions and subsequent scars depends on how much extra skin needs to be tailored. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.